Hi guys, I have not posted an update on my regenerative treatment and stem cell treatment. It's been quite a while now. I actually had forgotten about it. My life has been so much better, but it's taken a long time. I actually had my stem cell treatment in the back, let's see, Christmas. It's about a year and a half, a little bit more than a year and a half ago. So some people have been asking me about what treatment I had and how many treatments, what kind, doctor who did it, and also how I'm doing now. So I'll keep it brief. I have done a few videos along the way. The condition I was in a few years ago was such that I could really hardly stand more than 10 minutes. I was not able to finish making dinner. I had to lie down, and then I had trouble getting up. If I would like to walk the dog, we usually like to walk the dog 20 minutes, and 10 minutes into it, I had to sit down. And when I would get back, I couldn't climb the stairs. I would have terrible spasms. In my line of work, when I'm judging a dance competition or sessions are usually between an hour and 2 hours, sometimes an hour and a half, sometimes 2.5 hours. And I wouldn't have to tell the chairman that I'll need to sit down in between times when dancers come on the floor because I couldn't stand. What was wrong with my back? Well, our spine and our back is a very complicated area, and that's one of the reasons it's difficult to treat, besides the fact that we just really don't have a lot of options to treat back pain. If you're already of a reasonable weight and you're already in good physical condition, your bones are generally healthy, and you're an athlete, it's even more frustrating because most people's back pain can be treated by losing weight, having a better diet, doing core exercises, not just for the back and the midsection, but in rotational movements and so on. But if you're already in that situation where you're in good shape and you try to exercise, and as a dancer, you know, is very much in good shape and trim, so I couldn't use the normal things to help me out. And I'd love to have all the money back that I spent on physical therapy, which didn't help me, and chiropractic and massage, and I had some kind of Chinese medicine where I would take this sort of an herbal thing that was supposed to increase my circulation, and I used different patches, and I had acupuncture, and I had Graston, and I had active release therapy, and well, I can't even name all the things that I tried that didn't help. Epidurals did not help me at all. So over the years, I've had a lot of trouble with my back. I don't have a situation where there's any surgery that would help me, so that's maybe a good thing. No one has ever suggested anything like fusion. I do have good disc height. I have several herniated discs and degenerative discs, but from what I understand, if anyone gets an MRI, whether they have back pain or not, they probably have degenerative disc disease, or let's say bulging discs, or discs that are smaller than they should be. But a lot of people have bone on bone, and I did not have that situation. So I didn't have a spinal fusion situation. My facet joints are very beat up, and some of that's probably from dancing. I had an episode many years ago after a fall with one of my students at a dance competition. And we didn't know that it was my back for a while. I was looked at for kidney stones and all kinds of other things. So we went on a 3-month mystery tour trying to figure out what it was. And finally, what we believe is that I may have fractured one of the little processes on my spine. When that happens, then instead of your spine being able to maintain its stability, you can have slippage. Spondylolisthesis is what it's called. Now, I do know some people that have that so bad that they've had to have fusion in order to stabilize their back. Mine is apparently very small, and was a small enough amount that Dr. Lieber, who is my Regenix physician, my regenerative doctor, said he can probably stabilize what I do have by treating the ligaments. So I know I had loose ligaments, and as a dancer we tend to stretch to a fault, and there are some things I don't do now that I've been advised not to do, certain yoga poses like the plow, where you put your legs back over your head. There's no need for my back to be that flexible in that direction. So in flexion, you can certainly stretch too much. And if you stretch your ligaments too much, like an old piece of elastic, it's been used too many times with a rubber band, you can lose the elasticity and the tone in the ligaments. And your ligaments are not like your muscles where you can strengthen them and increase your quality and tone. They're really loose. So when that happens, the only option we have is to do some kind of prolotherapy. The traditional prolotherapy would be done with a dextrose solution. And you treat the ligaments. It irritates the ligament, which brings blood flow to an area of the body that has poor blood flow generally. So Dr. Lieber said this was the main thing we needed to try to do with my back, is try to stabilize it, because we didn't know how much is when you have the spondylolisthesis, or the shifting, this wears on your facet joints. So in addition to all the back bends and everything that I've done, I have more wearing there that can also wear at your discs and tear your discs or wear them down. So I had some back trouble before that, but we think that that incident probably set everything in motion. So what do I have? Beat up facets, enlarged facet joints, facet arthritis, pretty normal. How much I have, how much another person has, it's negligible to talk about. Discs, I have good disc height, but I have tears, herniations. I have scoliosis. We think that may have also resulted from the blow to my back, where I may have fractured that bone. And so then things got out of kilter, and I haven't been able to do anything to make me straight. So no exercises have helped me with that. So I'm constantly a little bit off kilter. If you're watching my dance videos, you can see that my right hip is always rotated and lifted. And if my back's bad, it gets worse. So have a little bit of everything going on, some scoliosis, some bad facets, some herniated discs, and probably a lot of muscular imbalances that are resulting there from that. And so you don't really know what to treat, and you have an epidural because maybe you can reduce inflammation. Fortunately, I never had any steroid injections into my facet joints, because you know that steroids can break down the cartilage. So I didn't go that route, but I did have several traditional epidurals along the way, which didn't help me. And I was in such a bad case with my back and with piriformis syndrome, the pain down through the hip area for lengthy time, and things were just getting worse. If I would stand, I would be in spasm, or I would be twinging in my back so badly that I couldn't go on. So I started seeing Dr. Lieber, I'm going to say 3 or 4 years ago. I went for my first treatment, and my first treatment was epidurals with platelet lysate. The platelets are taken from your own blood, and the Regenerative method is to then freeze those platelets, and when they're cracked open, you get sort of a time-release treatment. So for an epidural, this is less irritating to the nerves, and we're trying to stimulate healing rather than simply put in a steroid to knock the inflammation down. So I had 2 epidurals at 2 different levels, and then also my facet joints were treated with platelets, which comes from my own blood. So that was my first treatment, and then 3 or 4 months later, I went back and had more extensive prolotherapy. So I think I went for a year. I went about every 4 months and had treatment to stabilize my ligaments and to treat my facet joints. And I didn't have any remarkable sudden recovery, but very slowly over that year, I found that I could do a little bit more. I could stand a little bit longer. I could walk a little bit longer, but it was a very, very slow process. I forgot to mention I did also have the nerves burned in my back several times, which for some people this is helpful. For me, it was not helpful. So I went for 2 years. I went to Dr. Lieber in Pittsburgh, which is a 5-hour drive, so whenever I would go, I would have extensive work done. They would take between 24 and 30 tubes of blood and spin them down and then treat my facet joints and sometimes the epidural space for platelet epidurals, and also the ligaments. So after a couple years of treatment, as I'm gradually doing more and more and more, I decided I would go forward with having the stem cells in my facets. My doctor determined from my symptoms that he felt a lot of the problem was from the facet joints. And so, since your back isn't going to get better as you get older, I thought, let's go ahead and do it. And the stem cells cost me about what most women pay for their ballroom gowns. Fortunately, I sew, so I don't have to do that. So I'd rather put my money into my health. So at Christmas time then, 2017, I had 3 levels of my facet joints injected with my own stem cells. So that's 6 joints, so quite extensive. Dr. Lieber took the bone marrow from my pelvis, and there were 2 spots on each side, 1 spot on each side, and then he drilled several very tiny holes. The research shows that the layer of stem cells closest to the top layer are the richest. So to get the best stem cell count, you want to get various locations. So that's where we get the stem cells, and then they took blood and mixed the platelets with the stem cells. And I also had prolotherapy with my blood platelets at the same time. So that was fairly painful, and I had pain pills maybe 2 or 3 days at night. Had to rest quite a bit. And then after, I think it was 2 weeks from my treatment, when I was back in town, I did a dance competition with my students, and I was fine. So I started to feel some relief within a couple of months, but it's actually, for me, I've found with regenerative therapies that I take longer. And it's so gradual that you just, after a while, you notice, oh, well, I didn't have to sit down. Or I did a whole day of coaching today and I was on my feet the whole time. So I'm not going to say that my back is perfect. I'll always have a twingy back, but I decided to do the stem cells to try to stop some of the degeneration and increase my healing now while my stem cells are still good, while I'm young enough to have a good result. And then I went 1 year later, so in 2018, over Christmas time, since we go home through Pittsburgh, I stopped and had Dr. Lieber give me a tune-up, so that was the platelets again, just the blood platelets into the facet joints, and this helps to feed the stem cells. So I'm doing great, and I can work, I can walk the dog, I can make dinner, I can climb the stairs, I can stand for my whole judging shift. I don't have to get up and down on my lessons. And so to me, this is like I almost have a normal life. I do have to be careful. I can't do too much bending over, and I do have my days, but I'm so much better. So it's very important that you work on core strengthening and keep yourself fit, because no matter what you have done, if you're not going to stabilize the area, then it's not going to work. But I was in such a condition, there was no way I could do a plank. I couldn't, because I would go into spasm right there into my lower back. So now I'm able to do planks, and I'm able to do back extensions. I'm able to do a lot of the exercises that help me to maintain my back. But I was in such bad shape I could hardly do any of those. So I just want to take a moment and talk about AmnioFix. There used to be that it was difficult to find anything online about stem cells, and now everyone's getting into the business, and there's a lot of things that are being advertised as stem cells that are not. AmnioFix is a step between the platelets, or PRP, and stem cells. It's in between because it has many more growth factors than your blood platelets, but it's not as powerful as going to stem cells. It's also in the middle expense-wise. So if perhaps you would need 3 platelet injections for a particular area of the body, maybe better to go with the AmnioFix. I'm not familiar with all the different brands that are using amniotic fluid, but my Regenex doctor here in town is using it for some joints. The reason I went to Pittsburgh for my back is Regenex doctors are all specializing in certain areas of the body, and you have to go to someone who treats the spine. So I had to go out of town. But we have a wonderful Regenex doctor here, Dr. Stein at Beacon, and he's done stem cells on some of my students' knees, and they've had really great results. The knees respond really, really well. And he is using AmnioFix for some conditions. But amnio fluid is not a stem cell treatment. And it's important that if you're thinking about doing that, that you understand that. It is a powerful injection of growth factors, but not stem cells, so it's in between. The live stem cells are no longer there. Regenx has done lab work and tested to see this, and they found there are growth factors, there are many good regenerative biologics in there, but there are no live stem cells. So just so you know what you're getting, and I feel very secure to stay within the Regenx network. I know what their procedures are. They have their own database and follow their patients, and so I know there that I can trust them. So anybody else has any questions for my experience, you can feel free to contact me. And I have to say I'm very happy, but it's been a very long journey. And I plan to go again at Christmas time, not for stem cell, but for another boost with my blood platelets. Because I believe that I have to keep after my back and make sure that I do what I can so that I don't slide backward and see more problems in the future.